This podcast is sponsored by Western Summit LLC, proud supporter of Burrell since our inaugural year. Western Summit specializes and protects medical healthcare practitioners nationwide for all of their medical professional liability needs. Hey everybody, welcome back to another episode of the DO Pulse, a podcast about osteopathic medicine, community, and education. I'm your host, Sydney Alvarez. We have an amazing show for everybody, but first off, our show is brought to you by Burrell College of Osteopathic Medicine, but sponsored by Western Summit LLC. I'm joined by two amazing folks, as you can see. I am joined by Art Guzman, Director of Clinical Experiential Simulation. Did I get that right?
Yeah, I believe so, yes.
Awesome. And then I'm also joined by Ben Matkin, Director of Standardized Patient Program. Thank you guys for joining us.
Thanks for having us.
Absolutely.
Thank you.
So we are talking about some really amazing technology that we have here with Burrell. I'm going to start with you first, Art, and we call it our Sim Lab. Tell us what the Sim Lab is.
Sure, the Sim Lab is an area here at the medical school that we try to provide as close as a realistic type environment for students to come in and practice medical skills, work on different type of medical techniques that they'll be using when they go into rotation.
It's pretty advanced because I've had the opportunity to walk inside and they're learning how to, one that really stands out is work with patients that are giving birth, but there's a whole array of situations, real life situations that they're working with. Tell us about that.
Absolutely. So our simulation lab is housed with the Gomard products. Adult Hal, Hal Jr., Susie, Pediatric Hal, and the one you mentioned are live birthing.
We give them names. We
Yes,
give everybody
yes.
names.
They all have a name, exactly. So our Victoria is our 100% birthing mannequin that's available in the Sim Lab. And we have also other equipment as well too, task trainers that if we just want to work on a specific skill and not necessarily have to use the entire mannequin, we can just use a particular type of task manager or task trainer that we can use if students want to just focus on airway, prostate exams, lumbar punctures, and so on and so forth. We don't have to necessarily use the entire mannequin, but we just use that particular torso just for practice.
So let's talk about these simulations. You know, I mentioned the birthing mannequin. What are some of the other simulations that students get hands-on experience with?
Correct. So they have the opportunity to work with basic or advanced airways. They can work with lumbar puncture mannequins. They can work with Foley, male and female Foley catheterization. They can practice that as well too. As I mentioned, lumbar punctures is another one too. Assessments, EKG interpretations. CPR is another big one that they can use as part of the equipment that we have available to them.
And so how realistic does this get?
Well, we can make that very realistic. We can actually put the patient or the robot, if you will, the mannequin, in a particular type of medical emergency or medical situation where students come in either individually or in groups and come in and look at the entire set of vital signs that the patient is experiencing. Say, for instance, our advanced cardiac life support or ACLS, and a cardiac event may be taking place, and the students have the opportunity to sit in there, diagnose, run through algorithms, and run through procedures to help save that patient and aid that patient during that situation.
So let's take a quick look at our simulation lab in effect, so to speak. Watch this video.
What we're doing today is a birth simulation using Victoria, a birth simulator, a computerized robot essentially, that does almost all kinds of deliveries. We can simulate vaginal deliveries, C-sections, forceps, breech deliveries.
It's very important, especially in the labor simulation we just had, to be very hyper aware of how the mom is doing, how you're doing, and anyone that you have around you as well. So making sure that you have people to help you, you have your staff, your nurses, and etc. You have them with you to help.
There are specific maneuvers that the baby will do naturally in terms of labor and delivery, and then the physician can assist the baby into getting into the right positions and then teaching them how to get the head delivered, free the shoulders, and then accomplish the delivery itself.
You get an opportunity to practice before going into the real world next year, where you'll be expected to be helpful and have all hands on deck, and so it's really nice to be able to practice that.
Oh, it's immensely beneficial to the students because they've had some hands-on experience and they know what to expect when they get into the real delivery room during their third-year rotations and get to do this on real patients.
So Art, you're not kidding when you say it's realistic.
Absolutely. So this is as realistic as it gets with this particular model. She is very realistic, having been an EMT in the field and having done field deliveries. This is as close as it gets to the real thing. So
I'm glad you brought that up because I wanted to mention your background and how you bring your medical knowledge into these lessons. Tell me about this.
sure. Well, I have a background in as a paramedic for about 30 years. I am no longer in the field. I have retired from the field. Took a different direction, went into teaching, academia. Doña Ana Community College, where I taught there for a few years, and then moved over here to Burrell, and have been here ever since. So enjoy bringing that skill and that experience to the students here.
All right, thank you so much. I want to bring in Ben. Now, Ben, you are the director of the standardized patient program, and just like what Art was mentioning to us, this is the real deal. We're getting folks who are, what I'm going to say, pretend that they have an illness, and our student doctors have to figure out what's going on with them. Tell me about this.
Yeah, so throughout the semester, the students are attending lectures, they're studying on their own, they're attending labs with our faculty that teach here, they're learning how to interview patients, what physical exam techniques to use, and so in the clinic with the standardized patient program, we bring in actors and train them to display a demeanor of a patient and have certain background history, medications they're taking, surgical history they've had, family history, all this information of this patient. Then we'll add that into whatever the students were learning during that part of the semester, and they come in and are kind of tested on it with these actors who have memorized all the questions that they might be asked, what answers to give, how they should react to a student performing a physical exam. So the students are getting like a live version of what they just learned during that part of the semester.
With adults and children, we just had a very successful event with our pediatric event. Tell me about this.
Yeah, so our main actors are 18 and up in the program. We have around 120 people from the community that come and work with us during the semester. But for our pediatric event, we actually ask members of the community, members of our Burrell family, the students, staff, faculty to bring in their kids so that we can have our second-year students come in and do a well child exam and a sick visit with the child from age 0 to 12 years old.
So if people want more information on learning about the standardized patient program for both adults and for our youth, where do they go?
Yeah, so on our Burrell website, the burrell.edu, there is an employment section that gives people interested in this program an opportunity to apply. They can also email me directly at bmatkin@burrell.edu. Both ways of applying will come straight to my email, so I'll be able to handle all that traffic as it comes in.
So I'd like to ask people, and I'll bring this to both Ben and Art. I always like to ask people, what's the takeaway? In this case, why is it important that we do this from the student perspective, from the community perspective? I'll start with you, Art. Why is this important that we have, this technology?
The technology there is an effort to improve quality of patient care, safety in a controlled environment, so that when students are out doing their rotations, they've had the opportunities to have experienced this, so they can provide good patient care, and once again, safety is a big issue, and turning out good physicians on the other end.
Ben?
Our main goal is communication. We want the students to be able to feel comfortable speaking with a patient as well as needing to do a hands-on physical exam. And we also want the patients to feel comfortable with our student doctors. So it's all about giving them the opportunity to improve their skills and get that hands-on experience each time they come in.
Ben, Art, thank you both so much. The information is absolutely valuable and we sincerely appreciate it.
Thank you.
Thanks for having us.
We'll be right back.